by introducing myself. My name is Stephanie Okwere. I'm the lead for the Design for Health Practice at Co-Creation Hub. I'm basically lead the African Epidemiology and Nutrition Network known as AIM, which is actually one of the expressions of Design for Health Practice at Co-Creation Hub. Co-Creation Hub, as you may already know, is one of the, it's actually the foremost and largest pan-African we're really focused on improving contributing to improvement of African economy, and we're doing that by centralizing with innovation and then technology. I would like to also introduce our audience today to our guest, Dr. Chinonso Ugemba, also known as Aproko Doctor. He's an alumni of the Nnamdi Azikiwe University and is a Nigerian board certified medical doctor and an award-winning content creator. He's a public speaker and the chief editor of AprokoDoctor.com and thehealthytrade.com. He provides relatable medical advices, hands-on solutions to everyday healthcare promotion, and his brand combines years of medical experience leveraging social media for health education. I don't think that the doctor requires any form of introduction. However, I'll pass this over to audience across Africa. And I think it's important to also highlight that it's several awards of the world award for there's significant awards that he has so far, which actually speaks to the level of passion for making once again, so welcome to the talk. So to move on. Can you confirm that you can hear me?
There's a noise in your sound. I don't know if it's a fan. Sometimes it could be a fan.
Okay. Is that any better?
Yeah. Yes.
Okay.
It's worse now. It's worse now.
All right. Is it?
It's a lot better.
Better?
It's a lot better now.
All right.
Yeah.
Okay. So I just introduced Chinonso Ugemba, if you're just joining us, our award-winning content creator and medical doctor who's very passionate about health promotion, which I'm very much welcome to our Insta Live today. For us, we'll be talking about antimicrobial resistance. It's a very important topic for us, particularly because of the impact it has on the lives of people. We're recording globally, as high as about 4 million deaths as a result of antimicrobial resistance. And this is something that can be addressed if we can, handle some basic, if every one of us can play our role in addressing antimicrobial resistance. And so for us today, it's actually interesting having this conversation.
Yep.
This is one of our activities that we've been carrying out for the entire week, between 18th to 28th, to mark the World Antimicrobial Resistance Week. This week is tagged Preventing Antimicrobial Resistance Together. And this is just in acknowledging the fact that, everyone has a role. The One Health stakeholders have a role to play. So those interested in animals, in humans, in plants, we all can come together and play a significant role in addressing antimicrobial resistance. So at this I would like to, invite Chinonso to, take on some of the questions that we have, pressing questions that we have regarding antimicrobial resistance. I was speaking to a friend earlier this week, and she said to me, I'm definitely going to be on that Insta Live. And the reason is because Chinonso just knows how to break it down. Aproko doctor really knows how to break it down, help us understand, which is really why we're here today. So starting off today, I think my first question for you, to help the viewers understand what exactly is antimicrobial resistance to the layman out there. How can you explain what antimicrobial resistance is?
Yeah, so I think that first of all, we need to understand that it's a very important topic, right? Just like my friend here mentioned, Dr. Hyde, Emeka, said it's a very important topic, and that's because a lot of things are actually hanging on antimicrobial resistance. You cannot overestimate just how important it is. Before now, we used to be, or we still are. So it's not just human beings that are in the world. It's humans, you have animals, and then you have microorganisms. And in these microorganisms, you have bacteria, fungi, viruses that, we've just been collecting our own small spaces in the world. Forgive me, I'm going to make it very simple. So, we're just collecting our small spaces, paying our rent here and there, and sometimes we interact with each other. So, bacteria may come into the human body or the human environment, may get into their body, and may cause infection, right? Some others stay with us and do not cause infections. For example, the commensals in our guts, for instance, some of them even help us break down some of the complex food that we eat into something that our body can digest. But then there are now the other guys who now cause infection or cause negative effects to the body, right? And normally, what we did, thank God to Sir Fleming, was to invent antibiotics, right? And then antibiotics or antimicrobials in general was helping us keep the population of this microorganisms in check, so that even when they interact with us, we can control the population, kill them, or prevent them from multiplying, so that they don't cause infection. However, just as with everything, people are going to adapt. We keep saying Nigerians are one of the most adaptable people in the world. As things are getting harder, we're adapting to get, um, used to the hardness. It's the same thing for the microbials, right? As you're bombarding them with the antimicrobials here and there, some die. The ones that don't die get some genetic changes to, withstand the antimicrobials the next time that it's given. So, in the nutshell, antimicrobial resistance is basically resistance of these microorganisms to the drugs that were commonly used to treat them or are usually used to treat them. And okay, yeah, yeah. I think so that I don't complicate it further. Yes. So I think in the most simple term, this is basically what antimicrobial resistance is. We can hear you. Yes, we can hear you now.
Right. Okay, great. So I said I like the way you related it to Nigerians and how we adapt to
Yes.
things. Right. So in your experience, relating with patients and relating with people, would you say that people are really aware about antimicrobial resistance? And are there any misconceptions that you think that people generally have about AMR?
We are not aware. There's no. I'm not going to come and say, oh yes, some level of people. We need a lot of work in making sure that antimicrobial resistance is actually understood by the average man, because this particular, I don't want to say plague. This, hold on. There's a button on top. Help me press it on, because Yes. So this particular plague is something that is going to affect everybody. And the interesting thing about antimicrobial resistance is that it really doesn't care about how much money you're making. It's going to affect you one way or the other. So, and the sad thing is, a lot of Nigerians are not aware. I'm not going to talk about the world in general, but a lot of Nigerians are not aware. And one of the ways I know that we are not aware is how much we abuse antibiotics, right? And I mean, we can just walk into a pharmacy and the next thing we've gotten antibiotics just like that. It's so bad that people can get third third level cephalosporins from a pharmacist, just from a pharmacy rather, and without any prescription. And so because of easy this ease of access to antibiotics, it's also affecting the use of antibiotics because we also believe, if you have this, just take this, and if you have cough, take this. If you have catarrh, take this. If you have, and people are just prescribing antibiotics. Some people get the antibiotics, put it in their houses, and when their neighbor is sick, they give their neighbor the antibiotics that they didn't finish. So you have this misuse and abuse of antibiotics going up and down, and it's contributing to AMR resistance. I'm sure down the line we are going to understand just how well this
Yeah.
contributes. So we actually need a lot more awareness when it has to do with antimicrobial resistance because a lot is at stake, really. Because the thing with antimicrobial resistance is person A could contact a superbug, right? So for those who are just here, when you say superbug, a superbug is a microorganism that is now resistant to to the antimicrobials. And I'm using antimicrobials in general. When it's time to use antibiotics, I'll use antibiotics. Antibiotics are basically used to treat bacterial infections, right? So, but when we say antimicrobials, I'm putting antibiotics, antiviral, antifungal into the topic. But with antimicrobial resistance, the bacteria or the or the microbes that have now become resistant are now known as superbugs. And these superbugs could get Emeka can contact this superbug now. But it's not just Emeka that is going to have that problem. Some other person, let's say Pius or Philomena or Nkechi, may collect that superbug from Emeka and gets difficulty treating it also. So it is not just, oh, is this person that it has affected. Once it has affected you, every other person around you is fine. Because of the contagious nature of those microbes, any other person who is exposed to that person in whatever way could also get infected with that superbug, and then the infection spreads from there and becomes difficult to treat. What are the misconceptions that people have had with antimicrobial resistance? Some of us don't know it's a thing yet. Some of us also believe that now catch superbug, concern me. So we need to understand that it's not just the person who has contacted the superbug, it's about the wellness of everybody who is even around that person. You know, just like COVID, one person, before you know what's happening, 10,000 people, 100,000 people, 1 million people. So the same thing could happen with a superbug and we'd really have a problem on our hands.
Thank you very much for actually highlighting superbug and the impact. And I think one thing to take from what you just said, is that one person can affect a whole number of
Mm-hmm.
people, and people need to be aware of the impact of that. And before we go further, I've seen some people on the call already asking questions. People are asking, what is even the impact of this
Thank you very
microbial resistance?
much.
So, in layman terms for common people, and just to also reiterate that our audience is actually
Yeah.
African, right? So we have people joining from across Africa. What would you say is the impact? What are the impacts of
I
AMR?
will give some few examples. So recently, there is now a version of gonorrhea that is now resistant to almost every antibiotic. Normally, gonorrhea used to be treated by very simple antibiotics. But right now, there is a version of it that the normal antibiotics don't even treat anymore. And so people are now having to go. So basically, there's now a gonorrhea superbug. Also, there is a test that went viral on Twitter one time like that. It was a urinalysis test. So I think this person presented with UTI, and they found a bacterium in his or urine. I'm not really sure, which is a good thing because we don't really need to know the name and the sex of the person online. So um, this test went viral, and all the drugs that were commonly used to treat the UTI that were tested in that person's urinalysis, that particular bacteria was resistant to all of them. Now, somebody may be watching this and say, that's you people's problem. Make a new antibiotic so that everybody can go to rest. Let's solve this problem. And just, like you people did with vaccine, bring another one, let's treat it and go. Hey, I think for the past 20 years, no new antibiotic has been invented because antibiotics are not very easy to invent. As a matter of fact, some of us are still using antibiotics that were invented many, many years ago. And the problem with using the same antibiotics that we've been using for a very long time because of how difficult it is to invent and bring out new ones is that the more you expose the microbes to these particular, because let me be a lawyer on the side of the microbes, right? So that we can really understand this. These microbes are just living their life. It's not like, I really want to cause problem in the world though, so let me go and look for human beings to infect. They're basically just being themselves, right? Let's assume they have personality. And then you are now bombarding them with poisons to kill them and destroy their population. As with life, something is going to happen. It's either they die or they adapt to the new reality. And the new reality is what? We are surrounded by poison because the drugs to them are poison. To you, it's helpful because it saves your life from them. So, to these bacteria and these fungi and these viruses, to them, you're giving them poison and you're killing them. And with life, people are going to adapt. But here's the thing, the adaptation is not just because they want to perspire to aspire to recover the container. That's not why they're doing that. It's something that happens even within their genes. The same thing happens with human beings also, right? For example, we that live in the tropics, we tend to have darker complexions. The reason we have darker complexions is because we are always exposed to the UV rays of the sun. And so your body is finding a way, even deep down in your genetics, to shield you from the sun, right? So it's the same thing that's going to happen with this bacteria and the fungi and the rest of it. The more we bombard them with these things, the more they will find a way to adapt. Now, what are the implications? First of all, I need to make us understand that a lot of our healthcare is centered around antimicrobials. As a matter of fact, the fact that you are about to have a surgery and come out fine is simply because of antimicrobials. If you remove antimicrobials from the picture, there is going to be a problem. Also, the high the life expectancy before antibiotics was actually invented was very low. So think of then if you were fighting wars some of us like watching epic movies. If you were fighting wars during the time where they were watching, they were fighting epic movies and all that. If you get injured in the war, many times it's not even the injury that kills the person. It's the infection of that wound with microbes that end up killing the person. So childbirth is possible today simply because of antimicrobials. I mean, people get tears, and these tears are very close to the anus. The bacteria from the anus may also get in touch with the, particular vaginal tear. The only way to combat it and limit the spread of that infection is with antimicrobials. So imagine when childbirth becomes a problem. Imagine when surgeries become a problem. Imagine when let me not use the word small, but common infections are no longer treatable that becomes a problem. And if we are going to fight the war against the microbes and the yes, and the microbes generally without antibiotics, we're basically going to lose that war. Because even in the grand scheme of things, they outnumber us. Talk less of, yeah. So that is how difficult it is. We don't have new antibiotics that have been made in recent times. We're still depending on the old ones. Those bacteria are forming genetic changes within their cells that is making them become, resistant to this. And it's yes. Another someone here just reminded me of something. Another very you know, just an impact of how much we abuse antibiotics is that people believe that Ampiclox, Bicham Ampiclox, does two things. Number one, it prevents you from catching STDs. Number two, it prevents you from getting pregnant. I mean, it's a commonly held belief. I'm not kidding you. Like people actually will beat their chest and tell you, no, if you want to do that thing, just take and they tell you don't take the normal one, take Bicham because according to them, Bicham is the imported one, and the imported one works better than the original one. This is basically just antibiotic misuse. And when your body doesn't need antibiotic and you're taking those antibiotics, you're exposing the bacteria to what? To this, and it may not even be the bacteria that has the problem that you're trying to kill. It just means that they were around there when you took that misuse of antibiotics. They get in contact with the antibiotics, develop resistance against it. It's difficult to treat the next time. So it's a big problem. Oh. I don't know how best to make Emeka and Ikechi understand this thing, but it's actually it's actually a massive problem. And I've made videos on antibiotic misuse. And one of the things I do is I actually try to let them understand that it's affecting everybody, not just you. Everybody. Your children are at risk. Your parents are at risk. The doctors are at risk. The everybody's at risk. So it's not just these people that get antimicrobial resistance for their family. No, it's not antimicrobial resistance in the family. It's antimicrobial resistance in general. And once one person contacts a superbug, there's a likelihood that everybody is going to contact that superbug. So we really have to be careful.
Thank you very much for that. And I'm sure some persons may already be wondering, I mean, if one person gets a superbug, how is it that I also get it? How am I at risk? Can you explain how people around you can also be affected if
Yes.
you know?
I'm going to use our phones, for instance. So your phone has about I don't know the exact number, but apparently there's a lot more bacteria and microbes on your phone than there is on the toilet seat, which is actually a lot. And people we interact with our hands, right? And you shake people, you touch doorknobs. I mean, you probably don't think twice while touching a doorknob. And your hands are also used for very other intimate things. People go to the toilet, they use the restroom, and many of them don't wash their hands. I mean, I was in a popular shopping mall somewhere at Maryland, and I went to use the restroom. And this guy walked in, used the restroom, and walked out without washing his hands. And I just made a mental note I was never going to shake this person, only for me to get hungry. And I said, okay, I was going to go buy something, right? And I walked to the snack store, and I was about to buy a snack, only for the person who walked into the bathroom and did not wash his hand, gearing up to sell snacks to me. Of course, I refused. I was like, oh, thank you very much. I'm no longer hungry. I'm going to find my food somewhere else, right?
But you can imagine how many persons he may have served on the same day.
Exactly. So I want you to imagine that particular person, I'm 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 not going to name him Emeka because Emeka has more sense. That particular person has a superbug, probably in their urine or in their genital parts, right? And he touched his organ while he was having the urine. So some of them may have probably gotten on his hands. He's probably going to give it to 100 other people who bought snacks
True.
from him. He touched
True.
the
True.
doorknob before he left. If I touch that same doorknob, I'll probably get infected with whatever superbug he has. Now, let's imagine
True.
this person gets sexually intimate with someone else, and it's a sexually transmitted infection that has that superbug. That person is going to get infected with that superbug, and
True.
that person will take drugs that would normally cure that infection, but it's not going to be curable easily simply because that person has affected a, contacted a superbug. If that person does not have good hygiene also, that other person who has contacted the superbug goes on repeating the same thing that this first
True.
person gave to them is doing, and you can see how the chain
Continue.
builds from. I don't even need to be sexually intimate with the person to even get a what is it called, a superbug from that person. It could literally just happen. So the chances of spread, because of how contagious some of these infections are actually very, very. I think I lost my train of thought, but the 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 ease of spread is also something that is making us really pay attention to antimicrobial resistance, because it's very easy for anybody just minding their business to get a superbug, which also leads us to one of the ways where antimicrobial resistance can be toned down or can be fought against. One of the ways that that can happen is with what? Hygiene. As simple as washing your hands will save you from a lot
Yeah.
of problems.
Right.
And technology has even made this easier. Some people have smartwatches that remind them when they are washing their hands and let them make sure that they are washing their hands in the proper way. I mean, I even have a video on my page. Emeka and Nkechi, people need to pay attention. I have a video that teaches you how to wash your hands properly, because people just think that putting your hand under running water and just rubbing your hands together means you're washing your hands. No, there are steps to that. You rub your palms together, the back of your hands, interlace your fingers, your thumbs. Don't forget your fingernails, and then I see people have keeping long nails. You see, let me not drag people, but
Yeah. Thanks for that. I think we would elaborate a bit more on what people can actually
yeah,
do, to address antimicrobial resistance. But I think we can still take
yeah.
a step back. People have heard about what antimicrobial resistance is, how it can spread. But what are they doing in their day-to-day life to make microorganisms
So,
resistant? You know, so someone may be asking, what have I done? How do I contribute to this
yeah.
thing? And right now we're looking at a One Health approach, right? In simple terms, we're looking at all the factors that are causing it and everyone coming together, stakeholders coming together to address
I
it. How does antimicrobial resistance, what are we doing on in our day-to-day life that
yeah.
encourages AMR?
So if you notice, we have paid a lot of attention in antimicrobial misuse and abuse, which is also very important. But there are other factors that lead to that. Aside from that, I want to put the responsibility on different groups. So there's the group of the general population, and with the general population, bad hygiene, antibiotic misuse, antibiotic abuse, sometimes not even finishing. So yes, a lot of us are actually guilty of this when it comes to misuse and abuse. For example, the doctor gives you an antibiotic and tells you, okay, take this antibiotic for 5 days, right? Some of us take it for 2 days. And as soon as the symptoms are no longer there, bam, we have stopped the antibiotics and we are no longer feeling fine. What you probably did not know, which actually a lot of theory is actually based against, is that the particular bacteria that did not die in that phase may probably have gotten resistant to that particular antibiotics. So finishing
True.
your prescribed dose is important, because if you don't and you're in the habit of, once you're fine, nothing concern you concern antibiotics again. Forgive my French and my pidgin. That is actually putting all of us in danger.
All of
Some people, King Elito has actually opened himself. He says that some of these drugs will now be kept in the drawer till when you're feeling ill again. Now, some people just carry the drug that they did not finish, keep it in their drawer, and then when they now start feeling almost the same symptoms that they felt the last time, they think it's
Right.
the same bacteria that's causing the previous issue. So they go back to the drawer where they kept that antibiotics, take it without realizing that it may probably be a different infection. Sometimes it may even be a viral infection. And
Hmm.
you just took a dose that was not even complete. You kept the remaining dose. You got infected by another infection, took the half dose again. So you realize that rather than actually curing the problem, you are adding more to the antimicrobial resistance.
True.
Another
True.
thing is wrong prescription. Nigerians have still not understood that there are some cough and catarrh.
So sorry, sorry, before you go into wrong prescription, I really just want this particular
Yeah.
point to sink very well,
Okay.
you know,
So
with our audience.
yes.
So just to
So
reiterate what
okay.
you're saying in essence, right, that I not taking my medication
Yes.
rightly, Stephanie, for example, abusing the use of her medication, not completing her dose, wrongly taking drugs that are not prescribed for her can actually result in microorganisms that are already in my system becoming
Yes.
resistant to the drugs that
Yes.
and by way of the fact that I have microorganisms that are now resistant, one way or the other, I may be releasing them into the environment, and that could also put other
At
people
risk.
who come in contact with that resistant bacteria
Yeah.
also at risk, which means when I eventually, assuming I've been taking a particular antibiotics, I eventually need it because I am down with one illness or the other that responds to that should have responded. I would take that medication and it may never work for me.
Never will.
Not only that, my brother or my sister who's close to me, I may have also released those resistant microorganisms to them, and they also, so in that same way, the cycle continues and continues. Someone actually said we're taking ourselves 50, 100 years
I agree.
backwards because this was not the issue.
I agree.
These issues were resolved some 100 years back. Right. So to bring you back to your line of thought, we're starting to talk about, other ways and other people, how they contribute to antimicrobial resistance. Can you still hear us? Hello? Um, can you confirm that you can still hear us? Oh, I think we lost Aproko doctor. Um, Please just hold on for a few minutes while we try to reconnect with him. But while we wait for him to rejoin, please feel free to leave your questions and your comments. We're definitely going to come back to them. Exactly. Someone said, what doesn't kill you makes you stronger, applies to bacteria too. Definitely. If you're unable to kill them, they will definitely build resistance. Okay. We're still waiting for our doctor to rejoin. Okay. Okay. Guess they're still having some challenges. Please be patient with us as we wait for him to rejoin. All right.
Yeah, I think
Welcome.
my internet just went out, so I had to switch to another provider. That is one of the
All right.
that's one of the adaptations of being a Nigerian. You can see I'm becoming a super Nigerian. We've adapted.
All right. Welcome back. Right. So we're still talking about
Okay, yeah.
what people in the general public are doing to
Uh,
cause
yeah.
AMR.
So aside from the misuse that you just explained, another thing is sometimes patient education also plays a role. Because when I say patient education, there are some patients that feel that a doctor does not know what he's doing until you have prescribed antibiotics. As a you don't know what you are doing until you've prescribed it. And some of these patients come with some infections that are self-limiting. A very good example is the seasonal cough and catarrh.
Hmm.
Many times, infections like that are actually viral, right?
Right.
And one thing with viral infections is that most times viral upper respiratory tract infections are usually they are self-limiting. So whether or not you take drugs or you
Or
don't,
no.
it will take care of itself. But then
Yeah.
people start taking drugs probably around day 2 or day 3 of the infection, and by day 4, day 5, they probably start to get some relief. And as far as they are concerned, it is that antibiotics they took that is bringing the results, right? And we also advocate for doctors to better educate the public when it has to do with that, because sometimes you may even educate and say, oh, I don't think you need antibiotics for this, but then that patient is looking at you side eye and you're finished with them. This one, I've seen it real life. You finished with them, they go outside and buy whatever antibiotics they want to buy, because
Right.
like, why I go hospital, they no go give me drugs. Why am I now being in the hospital? And then small, you see why I say that HMO is not working? Because I went to hospital and all they just did was give me advice. So proper patient education is very important, because the better people know, the better they are now going to, you know, um, the better actions that they're going to take.
They will
When it
take.
comes to the healthcare
Yeah.
professional, sometimes there could be misdiagnosis, right? Probably, and then there is also the responsibility of the health practitioners to not prescribe, to not give drugs until there is an indication for it, whether or not it is to 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 pacify the patient, which I don't think is enough reason, because the risk of antimicrobial resistance is actually more important than the feelings of one patient. So we have to
Mm-hmm.
look at the bigger picture, because some people, well, we can just give them antibiotics. Some people do that to, let me not speculate,
Man-
but
we say manage their
you get
emotions.
some will
Yeah.
just manage their emotions, manage their expectations. Some others do it to
Mm-hmm.
shore up numbers in some private clinics. These things happen, right? And that's why we are having conversations about this, so that when these conversations are brought to the forefront, we would actually realize that it's not just the populace, the doctors themselves, the health practitioners themselves. Somebody mentioned something. Some people don't even wait for, it is also beautiful to now see some responsible pharmacies, because I was buying drugs at a pharmacy one time, and this person just walked into the pharmacist and they were saying, please talk to this person, and she had a phone, gave it to the other person, and the next thing they were prescribing symptoms. Oh, this is how he's doing this person, this is how he's doing this person, but they said I should buy this drug. And I was so happy that the pharmacist in that place was actually responsible enough to not just sell the drug, but now direct
Right.
the person to what doctor they needed. Because it was like, I think you actually need to see a dermatologist for this. rather than just coming here and getting a job. Because habits like that will still end up leading us down the road and taking us years backward with antimicrobial resistance. So there's the responsibility of the healthcare practitioners. There's the responsibility of the populace. There's the responsibility of hygiene. Even the hospitals. Should I give a small confession?
Yes.
I'm actually scared of hospitals. I will not lie. Why? The amount of germs in that place. The amount of microbes in the hospital. Every time I have to enter the hospital, I pray, I cover myself with not just sanitizers and everything, but with also extra bulletproof, because you realize that you're practicing in an environment where there are likely superbugs looking at you. Because aside from just the patients who come in with their own ailments, you also have the environments that are also cleaned with antimicrobial substances. And it's not all of them that die. Some of them actually become resistant. So even unnecessary exposure to these hospitals. Sometimes I feel that we also need to, come up with certain policies. I know, yes, your loved ones are sick and it's important that you need to go see them in the hospitals. But if there is no need for you to be there, please don't be there. Because even kids could get exposed, touch walls, touch things, and they get exposed to this. And you brought the child to the hospital healthy. Now they've left with one superbug or the other. Now, another thing that a lot of people have not been paying attention to, which because of the One Health approach, actually got exposed to it, was actually I got to find out that some farmers actually load their chickens, pigs, goats, rams with antibiotics
I think poultry farmers in particular.
Yes. Poultry farmers in particular. So a lot of the chickens that people are actually eating from farms have been loaded with antibiotics. And most of the time, the giving of the antibiotics sometimes could be for capital gains. There's this thing that says that, it helps them grow bigger. Sometimes they just want to cut costs when it comes to, and yes, while these things are quote unquote understandable, they are not condoned, because there is also, remember that we are all connected in one way or the other, right? Some of us, not some of us, because I've not started farming yet. Maybe soon I will start farming. But some people do it to make their animals grow bigger. They're doing it for capital gain. They're doing it because it's reducing the cost of actual taking care of the animals. But here's the thing that a lot of people need to understand. A lot of people need to understand that a lot of the farmers need to understand that while you are cutting cost of farming, while you're increasing your profits by the misuse and the overload of these antibiotics in the animals, you are actually affecting the human beings who come in contact with those animals. Because you may just go to the kitchen and then you buy, go to the market and then you buy a chicken that has been exposed to antibiotics. There's a likelihood that there is 1 or 2 superbugs in that chicken. You eat that chicken, you get infected with that superbug also, and all of a sudden there's a superbug in you that cannot be treated by normal antibiotics. So there are a lot of people who are actually affected by this antimicrobial resistance. It's not just because this person is taking drugs because they're, when they don't need it. It could be from the side of the farmers. It could be from the hospitals. It could be from the healthcare practitioners. It could be from the environment, just not having, proper hygiene enough. So there is a lot of interplay, which is why I'm actually happy that you mentioned the One Health approach, which is one of the things that would actually help us combat this antimicrobial resistance the best way that we know how, because it's us bringing all these sectors into play, because it's not just the healthcare practitioners, it's not just the farmers, and the One Health approach is that it's collaboration also between these sectors.
Right.
Yeah. It's collaboration between the sectors. Aside from collaboration, there's also coordination, and then there's communication. Sometimes some people in one particular sector may get wind of a particular superbug or something, right? It is best to communicate that to the other sectors as quickly as possible so that we can know how to best prevent ourselves from getting exposed to this or start to generate new guidelines, you
Right.
know, that would prevent us from getting infected. Another thing that also needs to happen is that the government has to become involved. The government has to take antibiotic resistance seriously, and not just the government, but the agencies that is responsible for drugs administration when it has to do with the drugs on the street, because as even the aside from even the farmers and the misuse of drugs, the exposure to counterfeit drugs also can also increase the rates of, the rate at which we're developing antimicrobial resistance. And let's face it, we're currently right there as a nation. I mean, you have pharmaceutical companies who have up and left Nigeria, GSK, for example, and they left with their antibiotics. That gives a lot of space for counterfeit drugs to fill the market. And as long as these counterfeit drugs fill the market, we are going to be affected by antimicrobial resistance, whether we like it or not. Because there's going to be substandard drugs that fill the market. These substandard drugs may not be just powder. They may just be a very minute level of antibiotics, which may not even be effective enough to treat properly this infection, but they expose the microbes to antibiotics, and as such, they develop antimicrobial resistance, putting all of us at risk. So it is not just the government, the agencies that are also in charge of making sure that the quality of drugs in the market, especially the Nigerian market and the African market, is of standard. I mean, there used to be a time when, before you get substandard things in this country, it was actually very difficult. But right now, so there are some standard drugs everywhere in the gap, and tighten those loopholes and look for ways to plug them. And it has to do with collaboration. It has to do with coordination. We have to communicate. All the sectors have to communicate, because whether we like it or not, if we do not check antimicrobial resistance, we are going back into, it doesn't matter the kind of technology we have. If we do not take care of antimicrobial resistance, we're going back to the medieval times. And very easy, very simple infections, very common infections are going to wipe out people.
Very true. Oh, thank you very much for really doing justice to that point. I think there's just a lot to get from this conversation we're having today. But one of the key things also is that we need to come together. And I like this year's theme for the World Antimicrobial Resistance Week. It's really preventing antimicrobial resistance together. And I like the fact that you're really, moving towards what we can do to solve the problem, right? You've talked about government, you've talked about, as individuals completing medication, right? You've talked about the challenge with medical professionals. You've talked about challenges also from people who rear animals, right? So the question is, for those who rear animals, right, and for medical practitioners, what can we do? What can be done to address antimicrobial resistance that is caused from these parties?
So there also needs to be, from the, I would speak on the part of the medical practitioners, right? Sometimes there could be updated guidelines, right? And when it comes to treatment guidelines, there has to be updated guidelines. It's not just prescribing because, proper indications. But aside from that, most health practitioners would actually require retraining and updating of information, because sometimes some things may have changed, but the doctor somewhere in a very small hospital is probably not aware. And we have to make sure that this particular information is updated across board. And there has to be a seamless way. We have to get a seamless way of making sure that communication amongst health practitioners is as seamless as possible. And that's why a lot of people are making the case for artificial intelligence, because the artificial AI doctor in Kafanchan gets in touch with a superbug, and immediately the AI doctor who is somewhere as far as the Arctic Circle is updated at the same time, because there's that there is that interconnectivity. So I'm using that same analogy when it has to do with doctor, because we haven't gotten to that point yet. So let's not get to that point. We need to create a seamless conversation. So doctor communities have to be up and thriving. Healthcare practitioner communities have to be up and thriving. Retraining, upscaling of training, new information as soon as they get added. Guidelines should be changed as quickly as possible. And some other people are also making the fight for making sure that we have shorter time dosages of antimicrobials, right? So we're looking for ways, rather than giving people very long periods of antimicrobials, let's find a way to get the shortest possible time with the best possible results that will give us the result. Because let's face it, if we're looking on the side of the patient also, patient adherence to drug regimen is also a problem.
Right.
I mean, if you tell me to take a drug for 10 days, except I'm feeling those symptoms for 10 days, it's probably going to be difficult. So patient education also will be very important. These are just some of the things that, off the top of my head, I can think would be one of the ways that we can battle antimicrobial resistance.
Right. Thank you very much. Thank you very much for that. And so just to reiterate, I think part of what Chinonso and Aproko doctor has, spoken to us about today is the very need for us to avoid infections in the first place. And one of the key things that he has highlighted is hand hygiene. Wash your hands as much as possible, as often as possible, as a critical way of reducing possibility of getting infections. But also for the general populace, you can, as much as possible, avoid the abuse of drugs. Take medications only when they are prescribed, especially antimicrobials, only when they are prescribed, and complete your dosage when you're provided, with your prescriptions. In addition, I think we've touched on, farmers as well. We've said indiscriminate use of antibiotics is also not great and has to be stopped. I was watching a presentation just recently, and someone was sharing data that has shown that with increased use of any form of antibiotics, there is an increased resistance among people. And I think it's important to highlight that several people have died or are dying as a result of antimicrobial resistance. So that overshot that you're giving to that poultry in your farm, that unnecessary antibiotics that you're giving to that goat in your farm, could have actually been impacting the life of some other person, such that they could actually even be losing their lives, right? Also, we talked about doctors, we talked about this, the gatekeepers for these antibiotics or antimicrobials. How are pharmacists prescribing? What are the guidelines available for doctors to effectively prescribe? And we talked about the role of government in ensuring that we have adequate policies and control to ensure that, the various guidelines are being adhered to. At this point, I would like to, move our focus to our audience. We have about 120 persons viewing right now. And they may have some questions related to AMR. So if you have your questions, if you have any questions, please put them up and we'll try to respond to them. Any questions regarding AMR? We should take them at this point. Okay. Right, so I don't see any questions. I know we had questions before we went off. Someone is asking, what is AMR?
Where do we start from?
Exactly. I think in simple terms, it's antimicrobial resistance. It's antimicrobial resistance. when your antibiotics, your antifungals, your antivirals no longer work, right? They are no longer able to kill or reduce the impact of the microorganisms or bacteria, whatever microorganisms in your body that you're trying to fight. Okay. So I don't see any questions. I think what that means is that, it was very simple. Okay, someone said, how exactly is AMR diagnosed? This could help guide on how to not unnecessarily consume antibiotics. Would you want to take that question?
Okay. So, how is antimicrobial resistance diagnosed? So, I think one of the things that we need to understand is that it's not necessarily a disease that affects one person. So, it's not, they ask you what is wrong with you, you say, I have antimicrobial resistance. The problem is not the human being. The problem is the microbes that get resistance to the drugs that were commonly used to treat them. In other words, those drugs no longer work. So if a person now gets infected with any of these microbes that are now resistant, it becomes a problem to treat that person. One very recent example I gave them during the beginning of this live was that there was someone who came for UTI tests and they checked the person's urine. Normally, what they do when you're checking urine is that you do urinalysis and you also check for sensitivity. When you're checking sensitivity, is that you're exposing the bacteria to different antibiotics so that when the test comes out, you know the exact antibiotic to give that person to make it go faster or treat better. It was found out that this person was resistant, or not this person, that the particular microbe that was infecting this person's urine was resistant to all the antimicrobial agents that they used. So you can see that that's a problem. What does that mean? It means that if you give all those antibiotics that were used to test against that particular microbe, it's not going to work for that person. And so that person keeps carrying a UTI that is not responding to the normal antibiotics. So if that person gets, or if that person infects another person with that particular microbe, that other person automatically is infected with a superbug, which is also difficult to treat. If that person goes ahead and infects a third person or fourth person or fifth person, so you can see how that circle is just going larger and larger, and we all have a problem on our hands. So that's in a short form is basically what antimicrobial resistance is.
Right. Thank you very much for that. So we also have questions here, quite similar to the same question asked earlier. Is when do you know that you are having antibiotic resistance? And I think it's important to buttress that you're not the one who is resistant.
Yes.
It's the microorganisms in your system that are resistant. And I think Aproko doctor just highlighted how this can be known. It's not something that you do at home, definitely. You can't run any tests at home to know that, the microorganisms in your body are resistant. You have to go to the health facility. They will run the test and then tell you what antibiotics you should take, which one is sensitive for that particular infection that you have. So we have more questions here. One talks about, I met you talking about animals. Does this apply to humans? I guess you already have that answer by now. We're talking about humans. It can affect animals as well. It can even affect plants as well. There are plant infections that are also treated with antibiotics. There are also plants that could be consumed that has resistant microorganisms on them. And as such, it can also be transferred from plants, from animals to even human beings. Someone says, does taking ginger and garlic drink and lemon or lime have any negative effect on the body? And I think I've seen questions around whether people should resort to lemon or ginger for sore throats rather than taking antibiotics. Do you have any comment on that?
Yes. So One of the comments I have on that is just like we mentioned earlier, if you have an upper respiratory tract infection, especially those ones that are seasonal, it is safe to assume that if it does not limit itself, right, or it doesn't stop by itself, many times a lot of these infections are actually viral. And here's the thing about viral upper respiratory tract infections, the runny nose, the sore throat, they may look like, quote unquote, the average Nigerian malaria and typhoid. Because Nigerians just assume that once you have fever, body pain is malaria and typhoid until proven otherwise. Sometimes the flu may come with this joint pain, malaise, just general weakness, right? But it's an upper respiratory tract infection. Because it's self-limiting, taking antibiotics to treat a viral infection is not going to do anything. Whether or not you take antibiotics to treat that infection, it will go by itself. Before you take any antibiotic, you have to have an indication for that. And one of the things that needs to be indicated for that is that the healthcare professional in the hospital has to be doubly sure that whatever is responsible for that infection, if it's not viral and is microbial, has to be treated for. For example, if you do a full blood count, for instance, and you can always tell, the trained doctor can always tell from a full blood count whether it's a bacterial infection or a viral infection. This would also help the treatment plan of that particular person. So if you're having an upper respiratory tract infection and it's viral and you need to go by itself, rather than taking antibiotics, you can help yourself. You just for systemic, let me not use the word systemic, just for, to feel better. Lemon, lime, those things can help clear your nasal ways and just wait for the infection to take care of itself. If it's viral, it will take care of itself. If it's not viral and it's bacterial, then see your doctor to prescribe the right medication for you.
More questions. And some of you may be wondering why I'm not taking your questions, possibly because they're not necessarily related. Some of these are some personal complaints that may need to be addressed directly with your health professional. So some related are all the questions that are related. I think all the questions that are here now, and we've actually also overshot the time that we are intended. But overall, I think it has been rather a very interesting session. I didn't even realize that we're already past 4 p.m. So a very big thank you to you, Aproko Doctor, for engaging us.
Thank you. It's been a pleasure. I hope we can do this some other time. Yeah.
We'll be looking. Yeah, thank you for sharing from your wealth of knowledge on this topic. I'm sure a lot of people who have joined this call have had a lot to take back with them. I also have had back with me. So thank you so much. Thank you for your time.
Thank you. Bye.
Yeah, do have a great day. Thank you.
You too.
And bye.
Bye.